Peace be upon you and God's mercy and blessings. I get asked a lot about acid reflux. What can it do to our throat besides the feeling of something hot or painful going from the stomach up to the esophagus or even the middle of the chest? By the way, not everyone complains about this symptom. More than half of patients don't complain about that pain. Instead, they experience other symptoms that I'll talk to you about today. This stomach acid is hydrochloric acid, which is slightly weaker than sulfuric acid, which is aqua regia. We see a lot of people who have lost their teeth, yet they eat meat and swallow all their food, even though they don't chew or break it up. And as soon as it reaches the stomach, this acid digests it. That means if this acid refluxes, if it leaves the stomach and goes up into the esophagus, and then reaches as far as the larynx or the pharynx, in other words, the mouth or the larynx, it can cause harm because it's like acid, it burns, and as a result, inflammations can occur. So what symptoms does a person experience? They might complain, and usually their complaint is during sleep. Reflux increases and the acid comes back up more. When we sleep on our backs, a person might wake up choking. They might wake up with a very severe cough. Also, there could be changes in the voice. There might also be an increase in nasal secretions and mucus. So the patient complains that their voice is different or that they have constant pain in their throat that lasts for months. It doesn't respond to antibiotics, or it might improve a little and then stop. The patient might even complain of ear pain as a result of this acid reflux. Of course, these problems are difficult to diagnose and it's hard to know what the cause is, especially if the doctor or the patient isn't aware of the issue of acid reflux. But when we treat the acidity and reduce this acid reflux, whether through medication or surgical interventions or with the help of gastroenterologists, all these symptoms go away. Sometimes though, the symptoms can be chronic, lasting for a long time and being very bothersome for the patient, like persistent coughing, choking, or changes in their voice. They might also have a lot of nasal secretions, swallowing them and all of that. A lot of people honestly come in and try to solve the problem by having their tonsils removed. They think these inflammations are due to repeated tonsillitis, when in reality it's just acidity. Wishing you 1,000 times good health. If you like these videos, please give us a like and subscribe to the channel so we know you're waiting for more videos from us. Wishing you 1,000,000 times good health.